Hello, my name's Elizabeth. I'll be your student nurse today.
Hi.
Hi. So just to make sure that I'm talking to the right person, can you verify your name and date of birth for me, please?
Dominic Veluso, March 16th, 1982.
All right,
Okay.
Thank you, Dominic. So I just wanted to talk to you today about the medication that you were prescribed and just briefly go over it. Is that okay with you?
Sure.
Alrighty. So you are a 37-year-old male, and I understand you recently underwent an anterior left hip replacement. Is that correct?
Absolutely.
Alrighty. So I see here that you were prescribed Gabapentin, and it's what it is. It's an anticonvulsant. It's used to treat epilepsy, seizures, and it's actually one of the newer anti-epileptic drugs. And what's interesting is that more than 80% of prescriptions for Gabapentin, they're written for off-label uses, and off-label meaning uses beyond the officially approved indication. That includes relief of neuropathic pain, so it's any possible nerve pain related to your surgery.
Cool.
Yep. So mechanism of action, and what that is how the drug works once it's inside your body. Its precise mechanism of action is unknown, but it may enhance a chemical in your body called GABA. And what it does, it stops or inhibits any firing of your nerves, which can cause any potential nerve pain or any nerve discomfort. So it stops that from happening. Another interesting thing is that it is directly responsible for regulating your muscle tone. So it's pretty likely, since after your surgery you're going to be on some kind of bed rest. And your muscles aren't going to be used. So what happens is that your muscles will probably start to atrophy, or they'll waste away a little bit.
So they'll like decrease?
Yeah, it'll decrease.
Oh, okay.
So in addition to, getting, once you start your physical therapy, in addition to that, this medication will actually help build up your muscle too as well. So I thought that was pretty interesting.
Is it okay to work out on the medication? Because maybe my wife could help me work out.
Yeah, I think you can work out. Like I said, you just want to take it slow. But
obviously what I could handle, because my surgery.
Yeah, absolutely.
Okay.
So, yeah. So, contraindications, warnings, that's actually more for the prescriber's side. There are multiple formulations of Gabapentin. It should not be confused. So the Gabapentin that you're taking, it shouldn't be confused with the other types of Gabapentin that are out there. One type of Gabapentin is actually approved for management of post-herpetic neuralgia. And just to break that down, that's treating nerve pain for shingles. Another Gabapentin, it's approved for the treatment of moderate to severe restless leg syndrome. Top 3 adverse effects. This drug is actually very well tolerated. The most common side effects you're probably going to be feeling are sleepiness, dizziness, and a condition called ataxia. And what that is, it's a neurological sign. It consists of a lack of voluntary coordination of muscle movements, so it can affect the way you walk, any changes in your speech, abnormalities in eye movements. These effects are generally mild to moderate at the most. And what's the good thing is that once you start using the drug, those side effects will start to go away, so that's good. And most importantly, you should avoid driving and doing any other or performing any other hazardous activities until you're confident that you're not impaired.
So I can take like the bus, right?
If you can, yeah, you can take the bus, but I would strongly advise maybe somebody driving you back and forth.
Because I usually drive a forklift at work.
Mm-hmm.
So.
Yeah, you probably wouldn't. I wouldn't use a forklift once you're on this medication. I would probably have somebody operate the forklift for you. But yeah, I wouldn't use any machinery once you're on this drug. So I'm sorry.
Okay.
I'm sorry to tell you that.
Sorry,
no problem. So all right. So do you have any other questions or any concerns that you want to hash out or ask me or?
No, I think we've covered it all. Thank you so much for your contribution to the business and your time.
You're very welcome. Thank you so much.
No problem.